Hey guys, here's a quick video for you for those folks that are receiving Plan Annual Notice of Change letter, also known as the Annual Notice of Change, affectionately known as the ANOC. And so if you are a Medicare beneficiary, newly retired, first year on Medicare, or just wondering what all the marketing is about in the fall, it is based off your plan's annual notice of change letter. If you're brand new, first year on Medicare, in the fall, the the um, the marketing is always towards your plan's annual notice of change. It's not towards, it shouldn't be based upon the benefits you might receive or could receive, because you may or may not qualify for those benefits. Even if a popular um, uh, retired football player is touting that you can get everything under the sun, like groceries and dental and vision and everything like that. So just know that when you receive your current plan annual notice of change, which means it's a private insurance company, they're sending you this notice because by law they have to tell you the changes that happen to your coverage and your cost, and maybe your cost sharing as well. So the resource is obviously, the official resource is obviously Medicare.gov. And I'm doing this search off Google because a lot of times you can see, what the ANOC letter is or what you're looking up very quickly on a search engine, and get the snippets that you need, and you don't have to go over every little detail and get your questions answered if they're on Google or whatever search engine that you use. And so I will show you the Medicare.gov website because that's official resource for the Medicare beneficiaries out there. And so the Plan Annual Notice of Change, also known as ANOC, what it is, if you are in a Medicare plan, and when you scroll over this, it will say any way other than original Medicare. Original Medicare is also known as traditional Medicare. Original Medicare on the provider side is known as fee for service. That's very important for you to distinguish that fee for service, original Medicare and traditional Medicare are one and the same. It's a trifecta, and it is not a Medicare plan or Medicare health plan known as a type of Medicare Advantage, known as Medicare Part C program. And so those are two different paths. So original Medicare, traditional Medicare, fee for service is not a Medicare plan. And so Medicare health and drug coverage, this term includes all Medicare health plans and drug plans. So you'll know them by network, like an HMO or PPO or an MSA. Those are network-based plans for your healthcare services, as well as your drug coverage possibly. And then there's also known as standalone Part D drug plans, PDP, pharmacy prescription drug plans. And so those will also send out letters. So if you're on HMO, PPO, MSA, if you're on a standalone PDP, and you have a pharmacy card, they will all send you a plan annual notice of change ANOC letter each fall. And the ANOC includes any changes in coverage, costs, and more that will be effective in January of the following year. So obviously, if you're watching this in 2022 and you're reading your plan annual notice of change letter, whether it's electronically or it's been printed out for you via your mail, then you will be seeing the changes, or reading about the changes to your coverage, costs, and more for the following year. And you need to pay attention to that because a lot of plans have been raising their premiums for Part D drug plans. And so the average annual cost for nationally for Part D drug plans was around $35. We all know everything's getting more expensive in 2022, but now the average annual nationally for drug costs for Part D drug plans is closer to $43. That may not sound like much, but for you folks that are watching every penny, there's a lot of beneficiaries out there on limited incomes. It's very important for you to understand that this annual notice of change letter could affect your monthly premiums, and you get it in September. And so who sends it? It's always going to be your plan. Now, it's going to be hard to discern that sometimes because of all the marketing that happens at the fall of each and every year. And so you really need to pay attention, or have someone pay attention to what you get in the mail to validate that it is your plan annual notice of change. And it'll say that on the letter. It'll also review the changes. If you're getting it via email, hopefully you're internet savvy and you can actually take a look at navigate the plan annual notice of change letter on the insurers out there, like this one, where it'll tell you the year, the annual notice of change, and then what's coming up for the following year. Obviously this is dated, and this is a what's called an HMO, dual eligible special needs. So typically for those folks, if you're seeing your current year and then your next year, you would see changes to your cost, like your monthly premium. So dual eligible special needs, a lot of times they're going to be zero premium each and every year. Max out-of-pocket amounts change from the previous year. Your doctor's office visits, your inpatient hospital stays, what changes there, and then your cost, your Part D prescription drug coverage from the current year to next year, whether you have a deductible or your deductible has raised up, and then the cost sharing for generic drugs, as well as the co-pays for those. And then it'll go on to say the actual costs for your any co-insurance that you might be susceptible to. And so from there, this is what a typical annual notice of change letter would look like. This is a sample of a particular brand. They're all different in the way that they send you and the annual notice of change in terms of how they lay it out, but they have to show you the changes in benefits, the cost for next year, if there is a change in max out of pocket, if there is a change in the provider network. This is very important for you to note, because your provider is not going to tell you if they're in and out of the network anymore. You have to make sure that you review this letter. It takes only about 5 to 10 minutes to make sure that your provider is still in network. Providers can also drop out of networks throughout the year. So hopefully, you've had a relationship with the provider for a long time, and making sure that with their front desk that they're still within your network, especially on these local HMOs, these smaller network-based plans. You want to really make sure that your providers are accepting the terms and conditions for payment from the insurer. Okay, so change in benefits and costs for medical services. Also, the prior authorization. So a lot of times that is a big issue with beneficiaries that are on Medicare Advantage, and they go to utilize certain medical services, or they want to, but they need prior authorization, which delays care in some instances, and adversely. In some instances it's okay, but just note that prior authorization has been known to delay some services. Not all, but it is a mechanism used in Medicare Advantage or Medicare health plans. So obviously, you'll see changes in the cost and cost sharing for dental services and coverages. If there's diabetes, if there's chronic conditions that affect you, you want to make sure like those things are covered, or if there are any changes that have been made, you want to make sure that you're using the actual medical equipment, medical supplies that are covered under your health plan, and it will be different for each plan, for each administrator, for each insurance company. So make sure that you go over this if you are in need of these services. There may be fitness programs. There's a lot of popular ones out there. I I recommend making sure that you get your health benefit first and making sure that's a priority, and looking over these annual notice of change letters, and then from there you'll go into your annual notice of change for for your uh, for your prescription changes to prescription drug costs. And this is a big one for a lot of beneficiaries because currently Medicare does not negotiate drug pricing. So that means in the future, hopefully, they're going to have it to where they're going to have more and more negotiation from Medicare, which is the federal government, to the actual drug manufacturers. But currently, it's through pharmacy benefit managers. And that's a whole different topic, but just note, if you are in a program that helps pay for your drugs, like Extra Help, the information about costs for Part D prescription drugs may not apply to you. So if you are receiving Extra Help or are receiving a low income subsidy, then some of these things may not apply to you. If you are reviewing it and seeing that your cost sharing, you can see that your deductible may change, um, your your Part D deductible might change. It could be, for this example, it's like 415 to 435. Obviously, this is dated. It could be as high as 480 for 2022. But for Medicare Advantage, a lot of times if you have your common medications within the formulary, or you have a Medicare Advantage plan that could have a low Part D deductible, as low as $100 I've seen. So just get with a independent Medicare insurance broker to see if there's better cost sharing plan numbers out there for you if you see a change in your drug coverage that is affecting your out of pocket. And so then it goes over the evidence of coverage as well. So, changes to your cost sharing in the initial coverage phase. It goes over all the details. So if you're a person that likes to get into the details of your annual notice of change letter, then this is really good, because that way you can decide, because you're being educated and informed by your plan. And if your plan is showing you like a premium increase of $50 for a Part D drug plan, that's definitely not good, and that's when you would shop your drug coverage for the fall, or your Medicare Advantage that has drug coverage included, but may be costing you more for next year because of your medications that you take. Okay. So here's another section on the annual notice of change. If you want to change plans, again, this is where I would invite you to learn more from an independent insurance broker that doesn't just show one plan or one brand of family of brand of plans. They can actually look into all the plans in your area, in your network, if you will, to be able to give you options that could be beneficial to you, whether you're shopping it because your hospital is just now accepting that carrier, which happens a lot, or if your provider is now wanting to have other carriers, or accepts or negotiates their payment through other carriers. Just stay on top of it, so that way you're not surprised when you go to when you get a EOB, explanation of benefits, or get a bill in the mail. So no one likes surprises or big bills in the mail, and so this is one thing that's going to help you, the Medicare beneficiary, or the person helping the Medicare beneficiary, because the plans do change each and every year. A lot of folks just ride it out. 50-70% of folks just ride it out because they're in good health. They don't mind paying the extra premium, or they're busy with their lives. But please note that there are programs out there to help you with free counseling for Medicare, Medicaid, programs to help pay for prescription drugs like Extra Help, and there's also Medicare savings programs available to those folks with limited assets or limited income, or need extra, just need extra services if you're in a PAYS community, or if you're looking for help with your family member and just don't know what to do. Don't be afraid to reach out to the Medicare community that's out there. And it just doesn't have to be one brand, because Medicare is obviously national, and it has over 63 million beneficiaries now. So I hope this has helped you with reviewing the plan annual notice of change on Medicare.gov, and you can easily do it through Google. But if you have any more questions in the fall about the changes that are happening to your plan, again, I would really advise you to speak with an independent broker that is able to help you specifically in your market. We're known as Medicare Savings down here in Charleston, South Carolina. We have a lot of hassle-free ways for you to get your information and possibly save you some of your hard-earned retirement dollars. I'm Mike at MEDICARESAVINGS.us if you ever want to reach out to me. I've been helping beneficiaries out since 2016, and I'll be more than happy to help you find some savings if at all possible. If not, then I hope I've at least given you the information on your Medicare journey that you are seeking. So thanks so much for watching, guys. Take care, and let me know what other videos I should make in regards to your Medicare journey.